You're listening to The Mark Cox Show. Find everything Mark Cox at 971talk.com/Cox.
If we pass no plan and let the Obamacare stand right now, can tax reform still happen?
No, it actually makes it extremely complicated. It puts us about $1 trillion further down the path or away from doing tax reform. So it's a very important point. We can't get to the next budget either, which is where tax reform is done. So it really would gum up the works, and it would make tax reform that much harder to achieve because we'd have all these Obamacare taxes to deal with as well.
Speaker Ryan, who's going to meet with the president tonight to talk about the way forward on this American Health Care Act. Sean Spicer's still holding his live news conference right now at the White House, taking a lot of questions about that, and we'll continue to play some of those for you. By the way, congratulations to Peter from Arnold. He won the 2 tickets to Brit Floyd. We'll give more away tomorrow and every day this week. Let me welcome my guest right now, Dr. John Goodman, who is the president and CEO of the Goodman Institute, and he's a senior fellow at this new healthcare plan. Dr. Goodman, how are you?
I'm great. Glad to be with you.
Well, thank you for joining us again. We appreciate that. What is your take on the American Health Care Act?
Well, it's very poorly designed, and I'm surprised. I'm surprised at it. But if you reduce spending on the uninsured by $1.3 trillion over 10 years, you take all that money away, a lot more people are going to be uninsured. That shouldn't surprise anyone. And people can quibble with the CBO about how many people exactly will be uninsured, but it looks like 14 million may not be a bad guess, considering how much money they're taking out of the system.
But if insuring them means that they're only insured because they're being subsidized on their Obamacare policy or thrown into an expanded Medicaid lot, I guess the standing theory on the right is that government shouldn't be in that business.
Well, here's what the right needs to understand. The left put up $2 trillion. And where did all that money come from? It came from special interests. ARP agreed to $850 billion of Medicare cuts. They never would have done that for Republicans, but they did it for Democrats. And then we had the pharmaceutical companies and the insurance companies, and all these special interests agreed to higher taxes so they could have health reform. So they put $2 trillion on the table. Now, what a lot of Republicans want to do is go give that money back. Why? Why give the money back to the special interests who created Obamacare? The conservative, libertarian thing to do with $2 trillion is have a tax cut. That's what we should do. And that's what Paul Ryan used to advocate, a tax cut for health care. So we all get the same number of dollars, but it has to be spent on health insurance and health savings accounts.
I want to make sure I understand what you're saying. If they go forward with the plan that they have, it would repeal all of the Obamacare taxes except the Cadillac tax, which hasn't really taken effect yet. That's not the tax cut you're talking about.
No. They're repealing all the special interest taxes. All those taxes they're repealing are taxes on drug companies and these are people who agreed to be taxed. They're not even asking for their money back. So why is Paul Ryan coming along saying, well, let's give it back? This is money that was there for health reform, and a conservative thing to do would be to take all that money and other money in the system, divide it up, and let's have a tax cut. But it needs to be a tax cut tied to health care, so we all get the same number of dollars.
Would those dollars go into a health spending account? Yes,
a health savings account.
Okay.
To be used for health insurance and health savings. Now, that's what John McCain ran on in 2008. That's what Paul Ryan used to believe, that let's take all the money, divide it up, and give each person an equal number of dollars and get the government out of the way. And that's what I regard as a conservative approach to health reform.
Is it possible to make that happen within the framework of this American Health Care Act, or do they need to start over?
Well, they need to get if it gets over to the Senate, they need to get the money back and do this the right way over in the Senate. It's going to be disastrous going into the next election. if we take insurance away from 14 million people. And in the meantime, the individual market is just going to get worse and worse and worse. Another really big mistake on the part of Paul Ryan is not allowing this tax credit to apply to the group market. The individual market has been destroyed. It's in a death spiral. And so now it's over in the group market where you find lower premiums and better coverage. So people who work for McDonald's and Burger King and don't make very much money, but they look to their employer for health insurance, we ought to let the tax credit apply over there,
right,
where the insurance is better. And we can insure 5, 6, 10 million more people between now and Election Day if we would do that. But the individual market is going to get worse between now and the next election, and I'm afraid the Republicans could lose the House for screwing this up.
Yeah, a lot of people are going to be thrown off of this. What about the block grant for Medicaid? Do you support that idea?
Yes.
Okay.
No, we need to do that. Medicaid is a mess. It's connected to the opioid problem that we're having throughout the country. And the only way to solve those problems is to block grant it. We need tough love at the local level. You can't do that from Washington. So we need Medicaid reform similar to the welfare reform we had under Bill Clinton. And absolutely, I support that.
Well, I mean, that's a start. I think this CBO report, I know they expected it. I think it's set them back on their heels a little bit. But what I'd like to see them do is go back to the drawing board now and redesign this. I love the idea of taking some of this money and putting it into a health savings account. Would it be when you envision that? Is it for every single American, every working American?
Well, if you just take the money in the individual market, I mean, you could do it, same number of dollars for each person in that market, but I'd rather do it for the whole system. I'd like to take all the money that we use to subsidize people getting health insurance at work and on the self-employed. I mean, we have all these different ways of giving people money for health insurance. It's all unfair. It's all arbitrary. I would take all of it, divide it up, comes out to about $2,500 per adult, $8,000 for a family of 4, and that's your share, and then get government out of the way and let the market work.
And the market's going to work because they're going to want to attract those dollars.
Yes, because the federal government is not going to be telling everybody what to do. Right.
Well, please tell me that somehow the Goodman Institute is getting through to the White House. Do you have a hotline to them? Can you call them?
Donald Trump calls me up every night.
That's good. I'm glad to hear that.
No, not really. No, I think that Donald Trump has been misled here. He was very clear during the campaign. He said he wanted to cover everybody. He wanted to reform the system. He didn't want to leave millions of people out on the sidewalk. Well, we're going to leave lots of people out on the sidewalk. And it's not just the people who were newly insured under Obamacare. Lots of people in the individual market were there before. And they were promised they could keep their plan, and they didn't, and their premiums doubled and tripled, and a lot of those are Republican voters. So a lot of people are going to be unhappy as a result of all this.
Very interesting take on it. Dr. John Goodman, thank you so much for your time. I direct people to your website at thegoodmaninstitute.org, and I hope to talk to you again soon.
Glad to be with you.
Very good, sir. Thank you. Well, that's a horse of a different color. I mean, that was explained to me just then in a way that I hadn't understood it before. But his theory is, why erase all of these taxes that were put in place on the insurance industry and the medical device industry? Now, I feel confident those tax increases have been passed on to the consumer, and I know that they cost jobs. But his theory is, why give that money back to them? Why not keep it and create a health savings account for every American to the tune of $2,500 and let them spend that money as they see fit on health insurance premiums. And if those premiums start to come down, then you start to see how the private insurance companies would then be fighting for that money. There'd be competition again.